Healthcare systems in the Triad made a big step towards returning to operation pre-COVID-19. Atrium Health, Cone Health, and Randolph Health have lifted their mask requirements under most instances. WFMY News' Hannah Jeffries spoke with doctors today, excited about the changes.
For the better part of the past 3 years, a lot of us have masked up. But when those restrictions lifted, we went ahead and put them away unless we had to go to the doctor or to the hospital. But now all of that is changed as some of the biggest healthcare systems in the Triad have made masks optional. Tuesday, many Triad healthcare workers are no longer behind the mask.
I've seen people full faces where I haven't seen them in 2 years. And I don't even know what they look like. You know, from the nose down.
I don't think we really realize the full impact of what a small gesture such as removing a mask can have until today.
The latest CDC guidance lets hospitals and healthcare systems make masks optional for workers, visitors, and patients. Cone Health, Novant Health, Atrium Health, Wake Forest Baptist, and Randolph Health all moved to mask optional.
I think that it's really good for our patients that have hearing deficits because they can go back to reading lips. I think it's really good for patients and family to see those emotional cues.
Patients may ask their provider to mask up, but besides that request, providers can mostly make that decision on their own.
As long as you're feeling well, that is, you don't have a cough or a runny nose or a fever or anything like that, and you haven't been reached out to by health at work, you haven't been exposed to anybody who's been positive for COVID.
However, there are certain parts of the hospital and situations where masks are still required.
In areas where there's a lot of immunocompromised patients, such as our cancer centers.
Experts say fewer COVID-19 infections and lower transmission rates gave way to optional masking, even in the most vulnerable fields.
It really is kind of a milestone for us because it reflects that that we've come to a place in the pandemic where we've left the emergency phase.
Healthcare experts say they are monitoring COVID-19 transmission rates, and if those rates do spike, they could reinstate the mask requirement. That's why they're encouraging people to be mindful of the ways that COVID-19 spreads. Live in Greensboro, I'm Hannah Jeffries, WFMY News 2.